Hi, welcome to my new channel. I am Brigid, and I refer to myself as the Snake Diet Warrior. Um, my purpose of this journey is I'm going to be fighting back at autoimmune diseases and other conditions. I'm going to be following the snake diet and doing some fasting. The founder of the snake diet is Cole Robinson, and I call him a fasting prodigy. But I'm really excited to get going here and see how far I can get myself to heal. The first thing I want to do here is just review some of the autoimmune diseases I have and conditions that I'm looking forward to hopefully healing. And I'm excited to get started and show you what I have to deal with. So, first of all, weight. I'm really high tech. I have never done a video before. My weight has gone up quite a bit in the last year and a half. You know, I can say that, with Lyme disease, I had oral and IV antibiotics for 7 years. I've been on prednisone off and on for the last year. I went cold turkey on tramadol, and my coping mechanism was food. I do have a binge eating disorder, and my food of choice is ice cream, smooth things. It's a texture thing for me. Um, and you could set down a meal in front of me, and I'd take maybe 2 bites of steak and push the beans aside, and I'd go get a half gallon of ice cream. So I'm working on that too. Chronic Lyme disease. I was diagnosed in 1996. I finally began treatment in 2012. I was refused treatment all those years because they had the common statement that Lyme disease doesn't exist in Minnesota, so or North Dakota or South Dakota. Um, some of the things that happened to me that can contribute to my general weakness and pain and weight is that I was when it got to its worst, I was 2 years bedbound and 7 years homebound. So I have a lot of work to do at strengthening muscles. Um, yes, indeed. Recently diagnosed with psoriatic arthritis. It's an autoimmune disease. I don't have psoriatic arthritis, but because I have first line family members that have it, then I'm susceptible to it. It's very, very painful. There's a lot of inflammation that goes with it when you have a flare, and it's treated with prednisone when you have a flare. I currently take methotrexate every Monday night. It's 4 little pills once a week, um, trying to keep the inflammation down. Oh joy, migraines. Currently, I take 40 milligrams of propranolol twice a day. The propranolol covers tachycardia, which I do have a high resting heart rate, but it's controlled with the propranolol. And it also helps blood pressure. I'm not on blood pressure meds at this time. I will be measuring my blood pressure and heart rate since I have some fluctuating numbers. I just wanted to let you know I contacted my cardiologist and asked him how he felt about me fasting to enter autophagy so that, I could heal, see how far I could take it. And all he said to me, because I asked if I could stop my medications, and all he said to me was okay. So I will be monitoring my blood pressure and watching for that. My next autoimmune disease is Lichen Sclerosis. It's a skin disorder. I also have been diagnosed with kidney disease. Right now I'm at stage 3 of 5 kidney stages. What I'm going to do here when we talk about this type of thing is that I will share labs, and so that we can track whether they're getting better or whatever. Liver enzymes and kidney is checked regularly with some of my medications, and I just like to see how I'm doing with that. So it's a good measurement. They suspect that I have gastroparesis. This is a condition that when you eat, your stomach doesn't empty properly. So next week, I'll be going in, and it'll break my fast, but that's okay. I'll eat a piece of bread and an egg, and they will somehow get a camera in my stomach and observe how I digest food. Um, it's kind of interesting. One of the main causes of gastroparesis is a possible damage to the vagus nerve. Did not know that. I also have a neurological disorder that came from Lyme disease, pseudobulbar affect. Say that. This condition uh, presents itself with involuntary crying or laughing. In my case, it was crying. I take a medication called Nudexa, and within a week and a half, I stopped crying. And I've been crying for years, and nobody picked on it that maybe she just can't stop crying. This medication was life-changing for me. I was able to begin using other parts of my brain that kind of shut down from the crying and the neurological Lyme. So just want to clarify that Nudexa is not a mental illness, or pseudobulbar affect is not a mental illness. However, Nudexa does umbrella over some hard to treat depression, so that's kind of nice. GERD, acid reflux, and gastritis. I do have a hiatal hernia, and I will be having it repaired. What they're going to be doing is with repairing the hernia, they also are going to go down and take the top part of my stomach and wrap it tightly around the opening of the stomach and the end part of the esophagus. I've had terrible acid reflux for many, many years. They've corroded my teeth. I recently had them repaired. The nice thing about the doctor is, and a little bit more encouragement, is I have to lose weight before I can have the surgery. And and if you're a binger, he wants to know what you're going to binge on. So if it was just ice cream, it may not damage that surgery, but if it was like big hamburgers or steak, it may damage the area that they wrap the stomach around. I plan to be fasting at that time, so it shouldn't be a problem. And it was kind of interesting. The gastroenterologist that I saw, he's up to date on fasting and had absolutely no problem with me doing extended fasting, doing OMAD or every other day um, meals. Uh, really liked him. Good bedside manner. Lyme disease gave me acquired mitochondrial dysfunction, and that is, the mitochondria is the energy cells, or part of the energy blocks in your cells. Um, they have been damaged, and there's some good ones and there's some bad ones, and hopefully with autophagy, um, we'll get rid of the bad ones. Um, how it presents itself for me is that I have a lot of weakness in my larger muscles, such as my quadriceps, and so sometimes when I'm walking, um, I need to sit down. I feel like I'm going to collapse, and I'm better. However, I sure have spent a lot of time on the floor. Now you're wondering why I have all of these things. Most of it, we believe, is attributed to not treating the Lyme disease in a timely fashion, and then there was damage done to me with the IV antibiotics and oral antibiotics, that I received for 7 years. Um, my I'm not treating the Lyme disease anymore. I'm more or less in remission or considered chronic Lyme. Um, but here's one theory that they have why uh, all these things are presenting themselves, and that's because I may have autonomic nervous system dysfunction. And basically, what that is the floodgates are open to fight or flight, and so everything just full on, just like going. It's exploding, and so with fasting, I hope that everything will calm down. I'll be, you know, meditating, lowering my inflammation, all these things, and try to shut those floodgates that are causing all these problems. Now I want to go into a few things. I like to measure things. Um, I'm going to give you some information. I kind of want to go back. I started the snake diet um, January 31st, 2019, and my highest weight to that date was 196. My BMI with that weight was 34.7, which is obese. My starting weight was 192, and that's a 34.0 BMI, which is still considered obese. I stopped the snake diet March 28th. That's about the time I got diagnosed with the psoriatic arthritis. On March 8th, I went from 192 down to 164.6. At that time, my BMI was 29.2, which is considered overweight. So, I just want to show you what happens when you stop and you need to continue forward for yourself. Where would I be right now if I hadn't done that? Anyway, that was a 27.4 pound loss in 49 days, averaging 0.6 pounds a day. And it all ended basically to a health crisis and my inability to cope with it, also prednisone. Today, my BMI is 32.6, which is obese. Bear with me. Starting weight, 183.8. I have taken measurements for many parts of my body, like waist, arm, bust, and this is just another tool of measurement, and I'll be sharing those with you as I hopefully go down. Of course, measurement of BMI will be tracked also with the weight. I also am going to be sharing my my labs. I do get labs quite often, every couple of months, to check kidney function and liver and my CBC count. And so I will measure those and share those with you. The other thing, since I am going to be going off of propranolol or lowering it, I will be monitoring my blood pressure. As of today, my blood pressure is 149 over 114. It's not the greatest, but it's not that bad. Now I want to share with you my before and after picture, my before pictures. And I'm not really tech savvy. This is the way I'd like to do my videos. But I'm going to share with you my before pictures. And for me to psychologically cope with what I'm showing you, it will be in this fashion. 1,000, 2 1,000, 3 1,000. It's just my way of coping. It's very sad. But anyway, I'm really looking forward to this. I'm very excited. Cole is my coach, and I really look forward to working with him. I do want to point out, there's some comments about, this being very dangerous. If you want some good information, you could follow or look up Dr. Jason Jung. He's a nephrologist, kidney doctor, who is passionate about fasting and just common sense things. And I'll link something so that you can check on that and what my favorite interview is. But anyway, I hope you subscribe to my channel and like this video. I really need a tribe behind me. I need some encouragement, and any note you write to me, I will respond. And so I really thank you. I welcome the comments, and I will see you every day just to report in. Thank you and have a good day. Peace.